So you've probably heard of blood pressure, and chances are at some point you've had yours measured. But do you know what the numbers mean and what they can tell you about your health? So let's start by answering the question, what is blood pressure? Basically, blood pressure is the amount of force that your blood exerts on the walls of your arteries. Blood pressure is measured by a sphygmomanometer in millimeters of mercury. It is measured in two values and written as a fraction, systolic over diastolic. The systolic pressure is the point when the pressure against the artery walls is the highest, immediately after your heart contracts. The diastolic pressure is when the pressure is lowest, when your heart is relaxed and your blood is not being forced out. So what do the numbers mean? Last year, the American Heart Association released new guidelines for what is considered a healthy blood pressure and what is considered too high, or hypertensive. A blood pressure lower than 120 over 80 is considered healthy, while a blood pressure of 130 over 80 or higher is hypertensive. Hypertension can cause heart attacks, strokes, and kidney failure, among other life-threatening events. So we know that higher numbers are bad, but what does it mean if your blood pressure is high? Hypertension begins when your heart has to work harder to pump blood around your body. If your heart is pumping harder, more pressure will be exerted on the walls of your arteries. When your arteries are forced to extend farther than they are used to, it can cause their inner lining to tear microscopically. Fats that float around in your blood tend to get stuck in the crevices that these tears create, and this leads to a buildup of plaque, which decreases flexibility in your artery walls. Less flexibility means your heart has to work even harder, raising your blood pressure even higher. What kinds of factors contribute to hypertension? Anything that activates your sympathetic nervous system, which you may know as your fight or flight response, constricts your blood vessels. When the same blood volume is forced through a smaller channel, your heart has to work a lot harder to deliver the same amount of blood to your body. That's why things like smoking and high stress levels can raise your blood pressure. If your heart has to pump more blood through the same size channel, it also has to work a lot harder. You may have heard that you should not eat too much sodium, and that is because sodium is absorbed into your blood. When your blood has a higher sodium concentration than the surrounding tissues, water will be pulled out of those tissues and into the blood through osmotic pressure. Gaining weight makes your blood vessels longer so that they can reach all of the new tissue, which means your heart has to work harder to pump your blood farther. Hypertension sounds scary, but here are 3 things that you can do to keep your blood pressure in the healthy range. First, eat a healthy diet that is low in sodium. Second, exercise regularly to avoid excessive weight gain. Third, take time to relax and lower your stress. While these strategies can apply to almost everyone, make sure that you talk to your doctor before you begin any new diet or exercise programs.